Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is part two of my thoughts and musings about PANS and PANDAS. In part one, I talk about what those acronyms stand for, and then some of the underlying possible causes or etiologies of those conditions, and a little bit about the pathophysiology. So in this video, I'm going to talk about some of the treatment approaches that I've seen work in my practice, and that's the main thing I'm going to discuss. So also in the first video, I talked about sort of testing options and really the lack of optimal testing options for those conditions. So in terms of the treatment for PANS and PANDAS, it really depends on the cause, of course. If the case of, well, I mean, in PANDAS, it's due to strep, and in that type of case, typically using antimicrobials that are geared at strep would be the most, one of the successful implementations that could be helpful. And then if it's due to something like Borrelia or a co-infection or a virus or possibly heavy metals or some type of a reaction to some other type of substance, maybe a gut component. I don't think I've ever had a case where there was something like SIBO or yeast dysbiosis or something like that was the driving force, although it could certainly be a contributing factor. But ultimately, it's about going after whatever the root cause happens to be. In my experience, the majority of cases I've seen have an underlying microbial component in terms of PANS. And once again, with PANS, it could be any of those microbes I mentioned, or mold mycotoxins, and then with PANDAS, it's just specifically strep. But in my experience, it's I think the majority of the cases I've seen have been more of an infectious nature in terms of the cause. Every once in a while, in my practice, it's been a mold underlying cause, and then sometimes mold is a contributor if there is something like strep or Borrelia or a co-infection or a virus being the driving force behind the PANS. But what it comes down to is if we have the luxury of doing some testing, that can be useful. So doing testing to see if there is evidence of mold or some of those infections that are mentioned. But if we don't have the luxury of those tests, then we can always work with more of a therapeutic trial based on what makes the most sense from the clinical history. So if the patient had been in a moldy environment and then their symptoms started, then that would be a clue to probably go after, treating for suspected mold or might motivate to do the test, or if there was a history of a bullseye rash or exposure to some type of after some, weird bug bite or skin reaction, then that's when some of the symptoms came on, or if it was after a bout of like a really bad sore throat, it wasn't necessarily confirmed to be strep, but there seemed to be a correlation there, or if it was after food poisoning or something like that, we can sometimes, semi-regularly figure out the most likely underlying culprits based on the clinical history. But testing is always a nice luxury to have. The agents that I found to be the most effective in practice have been generally a combination of three different things. One of them is working with antimicrobials, so appropriately selected antimicrobials. Oftentimes we want to work with antimicrobials that move systemically through the body because where there's this neuroinflammation issue driving the PANS or PANDAS symptomatology, we want to make sure that what we're using can actually, have a good chance of penetrating the blood-brain barrier and going systemically, where these microbes sometimes like to hide out. And so that would be using a lot of the herbs that are inspired by the work of Stephen Buhner, this amazing herbalist out there who's written definitive texts about Lyme or Borrelia and co-infections, and talks about viruses as well to some extent. The challenge, of course, where it's pediatric patients, and oftentimes these pediatric patients are understandably having behavioral challenges in many cases. Sometimes compliance is an issue, so working with herbs that have the least vile taste to them is really important, and thankfully some of the best systemic antimicrobial herbs don't really have much of a taste to them, especially if you mix them in a little bit of glycerin or some juice or applesauce or water or whatnot. So we work with the best tasting systemic antimicrobial herbs possible. If there's more of a gut component, we usually use different herbs to help, in a liquid form to help tackle that. So the sort of the killing aspect of things is oftentimes important. And then the second of the three things is making sure that we're supporting the patient's underlying biochemistry or physiology. So if the patient has any signs or symptoms suggesting that there's a magnesium deficiency, as evidenced maybe by constipation, or melatonin deficiency as evidenced by maybe having some sleep-related issues, or if the child is really kind of like low energy or a bit listless, then we might need to get into some B vitamins or things like that. Or if they've been eating a really nutrient-poor diet, maybe we want to get into some methylated B vitamins or some minerals or things like that to try to support their underlying physiology. And then the third category or sort of branch of treatment that's been arguably one of the most successful implementations in my practice is using either low-dose immunotherapy or an offshoot, well, not an offshoot of that, a related therapy called isopathic therapy. And that's basically where we're using different agents, basically the culprit in question of the, say, the microbe or the toxin or what have you that triggered the PANS or the PANDAS. We're using a diluted preparation of that to, for the easiest way of thinking about it is to desensitize the immune system, so it's no longer having this pro-inflammatory autoimmune type reaction to whatever that microbe or trigger is. So for example, in the case of PANDAS, where it's a strep issue, using LDI or isopathic formulas to desensitize to strep can be incredibly powerful, work very quickly when we find the right dose. It can work really, really well. And I've had a number of patients over the years where they've been under the care of another clinician and they say, diagnosis of PANDAS, they've been on antibiotics, the antibiotics have been very helpful, but the patients still, they've hit a plateau, or they do well and then they have to keep going back on antibiotics and their microbiome in their gut's kind of getting wrecked, for lack of a better word. They're getting a lot of other symptoms. And so it just seems to be like this almost like a revolving door. And so I found that low-dose immunotherapy or isopathics can really help to crack those cases and get the patients all the way well and staying well. So those are the three areas or treatment branches that seem to be the most successful in my practice. I have posted previous videos about low-dose immunotherapy. I also have a fairly extensive YouTube video about low-dose immunotherapy. And then there's other videos out there on YouTube and probably in other places from the doctor who created low-dose immunotherapy, whose name is Ty Vincent, medical doctor from Hawaii, brilliant guy, and has good content out there as well. Not as much information about isopathics, but it is a similar type of therapy in my opinion and in my experience. So I hope that information is useful. If anybody watching this has other specific questions about PANS or PANDAS that you'd like me to talk about, just feel free to comment or send me a direct message, whatever you want, and I'm happy to yap about whatever aspect of this people are interested in, because I think it's really fascinating and really important to talk about treatments for this, because it's just not a very widely known or recognized condition, unfortunately.